Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. On today's show, all our stories are about COVID-19. We will talk about how a number of states in the country are now seeing a rise in cases again. We will also talk about how Delhi's pandemic situation is being reflected in its crematoriums. But to start with, we talk about the first official assessment of the fallout of the pandemic. The Parliamentary Standing Committee on Health and Family Welfare has assessed the response of the government to contain the novel coronavirus pandemic and mitigate its impact. The committee last week submitted its report titled The Outbreak of Pandemic COVID-19 and Its Management to the Rajya Sabha Chairman M. Venkaiah Naidu. In this segment, we speak to Kaunain Sheriff, who reports on health for the Indian Express, about the highlights of this report.
So the Parliamentary Standing Committee on Health and Family Welfare in the last few months had summoned senior officials of the government who were the face of the pandemic, from ICMR chief, the AIMS director, the Niti Aayog chief. You had senior officials of the NCDC and, of course, the bureaucracy, the health secretary, and had gone into almost all of the aspects of the pandemic, whether it was the hospitals, the cost of treatment, surveillance, testing, issues related to the frontline workers, and other various issues. And this report has now been submitted to the Vice President of India, who is also the chairman of the Rajya Sabha. This report is significant because it's the first official assessment on the fallout of the pandemic.
Kaunain takes us through the various issues and points that the report highlights. And the first big thing that the report talks about is the poor state of primary healthcare in the country.
Then it goes on to say that the pandemic COVID-19 offers a window to revisit the country's health policy, especially related to the expenditure, that there is a requirement of higher investment in creating a permanent basic health infrastructure, which we keep highlighting about how abysmally low our health expenditure is in terms of percentage of GDP.
This is something that gets highlighted time and again. The fact that India only spends approximately 1% of its GDP on public health, which is one of the lowest in the world. The report proposes to increase that budget.
So it says that it's time that we start fixing higher targets of more than 2.5%. It says that that should be done within 2 years as a set time frame, so that if at all we face another pandemic, then things don't go out of control.
When it comes to other medical aspects, the report focuses on three main points: hospitals, surveillance, and testing. When it came to hospitals, the committee said that it found that the number of government hospital beds were grossly inadequate, especially compared to that of the private hospitals.
Trying to say that people had to actually go to private hospitals, approach the private hospitals for treatment. It talks about how there was a frantic search for vacant beds, which had become quite a harrowing experience. Instances of patients, like we have reported, of being turned away from overburdened hospitals due to lack of vacant beds. It has also suggested that people had to spend more out of their own pocket expenditure on health and treatment because they were going to private hospitals, and this would have led to many families now going below poverty line.
The reports, he says, also points out that the government didn't arrive at a sustainable pricing model for treating COVID-19 patients, and if it had done that, then more lives could have been saved. It also says that the government should have strategized a better partnership with private hospitals and that it needs to get more patients enrolled in the Ayushman Bharat scheme, which is the government scheme that aims to provide free access to healthcare to roughly 40% of people. Apart from hospitals and access to healthcare, the next big point was surveillance.
It has actually multiple times noted in the report that there was poor contact tracing, slow testing in the initial phase of the pandemic, which led to increased number of infections. It has made very, very strong observations on the National Center for Disease Control, which is supposed to be the apex body for such outbreaks. It says that it failed to perform its function. It says that the government should have utilized NCDC in a more effective manner, especially because of the fact that it has been established to respond to outbreaks. So that is the big takeaway on surveillance. It says that the ministry, which is the health ministry, has to allocate more money to NCDC.
Now, after hospitals and surveillance, the report talked about testing. And it said that instead of using the gold standard for testing, that is the RT-PCR tests, India has been using too many rapid antigen tests, which are known to give a lot of false negatives. It said that because of this, the country is at a high risk of missing out on a large number of cases.
And then on testing per se, it also goes on to emphasize that the testing facilities in India right now are limited to bigger districts and cities, which is the metros. And that lack of testing facilities in rural areas, which is the PHCs, has resulted in underreporting of cases, which means that India has much more number of active cases than what is being actually officially being reported by the ICMR. So it says that the primary health centers, which is the backbone of the public health, are still largely devoid of any testing facilities and require technical workforce. So it recommends the government to build a strong network of what we call as the viral research diagnostic laboratories, which do the RT-PCR test.
So far, we have discussed hospitals, surveillance, and testing. Now we move on to the other aspect of the report, which focused on human resources, like doctors and ASHA workers.
The committee has expressed its anguish over the mistreatment of ASHA workers engaged in the contact tracing and surveillance. It says that it's pained to note that the community health workers were denied wages, again, which is very commonly reported in the national capital. It also talks about the large amount of vacancies of doctors in public hospitals. You've seen how during the latest crisis in Delhi that the government had to actually get army doctors airlifted. So this is on the large pandemic response related to the immediate emergency response on the medical side.
Before we talk more about the report, it's important to note that ASHA workers have been at the forefront of India's fight against COVID-19. They have been in charge of surveillance, contact tracing, and spreading awareness of COVID-19 protocols. Yet many, since the beginning of the pandemic, have been facing abuses, harassment, threats, and even witnessing fights. Many, like the report says, are denied wages, while others are sometimes paid as little as 1,500 rupees per month. Now, this report also talked about three other aspects that it says have been neglected by the government. And these are the effects that the pandemic has had on women, children, and mental health.
On women, it has gone on to dedicate almost a chapter. It says that pandemic has not only adversely affected the women's mental being, but also disrupted access to healthcare services, which here the report talks about the sexual and reproductive healthcare. It says that access to contraceptives services became difficult, which may have led to unwanted pregnancies and unsafe abortions. It says that government has to chalk out a very, very specific plan for rescuing women out of mental trauma by resuming sexual and reproductive health care. You know that in the tier 2 cities, this has been completely disrupted. The committee then goes on to talk about the violence against women increased during the pandemic. So the committee again says that the government has to identify women who have been victims of sexual and domestic violence during the pandemic and rehabilitate them. It is spoken about that the ministry has to create a specific hotline, telemedicine services, and rape crisis centers for women.
When it comes to children, the report talks about how schools being shut has impacted them in a country like India, where the digital divide is vast.
It uses the word that this would have jeopardized the future of millions of students from the economically weaker section of the society. It says that the government should strengthen its network for digital and the online classes at every level, at least till the normal classes resume. And provision of special classes when schools resume, then it has to provide special classes for these students who have missed due to non-accessibility of internet. So that's for children. On mental health, again, two aspects. It talks about how there has been a considerable or significant rise in mental health issues during the lockdown. It has spoken about the economic impact, how people have lost employment, because of which there's social isolation. So, I mean, it says that there is no denying the fact that people have had to stay away from their families, have lost their jobs, and are more prone to depression and anxiety. The committee has said there has been an increased risk of suicide during the pandemic due to the social isolation and the loss of employment. And then it strongly says that the government has to bring in a mental health policy related to the pandemic.
On previous episodes and in other Indian Express podcasts, we have talked about these problems in detail, and you'll find links to those in the episode description today. Now, even though this report talks about all these different aspects, Kaunain says that there are things that it doesn't highlight. For example, he says that it doesn't get into what should be the standards and protocols for Ayurvedic and homeopathic medicines being pushed by the Ayush Ministry, considering many of these medicines are being touted as immunity boosters.
And also very little on the private sector, the overcharging of the bills. It's spoken about the instances, but there is no detailed blueprint on just the role of private sector. In fact, it has appreciated the role of the private sector in this. And of course, it has gone into the research aspect that we need higher budgetary allocation. But again, on those aspects, it has not gone into too much of details. These three aspects, I think, as the pandemic evolves, I think this parliamentary committee will again maybe go on the second phase and scrutinize these in detail, because we have vaccine development and we will have vaccine access as a big issue coming up in the next phase of the pandemic, because you will have so many vaccine candidates that will be coming into the market. Access will become very important. Tracking them will be very important, because there is always a possibility that the vaccine that you get an emergency approval is proven to be 100% safe. So you might have adverse reactions. So you need to get that in place. You need to have an IT infrastructure into place. Government has submitted basic architecture of what it's going to do on a vaccine. But I think those details are not there in the report.
Dear listeners, before we move on to the rest of the show, I just wanted your quick attention. One of the big reasons people say they like this show is because it helps them understand the news better. It provides them with the context they need to see the bigger picture. And there is perhaps no other place that does that better than Indian Express's Explained section. We on Three Things refer to the section regularly, and it helps us make this show. If you're a regular reader of Indian Express, you know how useful the Explained section can be, especially when you're looking for in-depth analysis by the right experts. You can log on to indianexpress.com/explained and access the coverage 24/7. Explained by Indian Express, where news that matters is explained by experts who know the subject. Now, back to the show. And next, we talk about the rise in cases in certain states. Now, in the beginning of the pandemic, say between April and June, states like Madhya Pradesh, Gujarat, and Rajasthan were seeing some of the highest number of cases. But after that, the cases in these states considerably declined. And there seemed to be very little activity in terms of the spread of the virus. But now these states are seeing a rise in cases once again. To talk about this rise, we speak to Amitabh Sinha, our resident editor in Pune, who's been studying the coronavirus numbers since the beginning of the pandemic. And he begins by talking about the possible reason for this spike.
I think we can only speculate on the reason. As of now, these states had been declining for a very long time, or the cases had stabilized for about 3-4 months. There wasn't any surge. And then possibly there was a bit of complacency amongst the public there. And during the festival season, it might just have led to people not adhering to the kind of physical distancing that was required, because for a very prolonged period, there were very little cases happening. So that might be one of the reasons. We are only speculating. As of now, we do not really know. Each individual state might be having different reasons of their own. But in general, that might be one of the reasons, the crowds during the festival season. It was always expected, if you remember, we have been talking about it, that festival season might just see a spurt in cases. And that is what seems to be happening in at least these states.
Now, even though these states are seeing a rise, Amitabh emphasizes that it doesn't mean that they have the highest caseloads in the country.
So the states which were contributing very high number of cases in the last, say, a month or so, Kerala and Delhi, for example, those states are still, in absolute terms, those numbers are still much higher than what Madhya Pradesh or Gujarat is contributing now. But compared to their own numbers, say 2 months ago, Gujarat, Madhya Pradesh, and Rajasthan are seeing a surge right now.
Considering the spurt in these cases, the Health Ministry has dispatched high-level central teams to Madhya Pradesh, Gujarat, and Rajasthan, and also in Punjab and Uttar Pradesh.
So the central teams, actually, if you remember, central teams, they get dispatched to every state where there seems to be a problem arising. So in the past, such teams have visited Maharashtra as well, Kerala. Those teams have gone to Gujarat, West Bengal, everywhere. So right now, the problem states seem to be the ones that I just mentioned. Those are the states which are seeing a rise in the active cases in the last weeks. And their numbers are still not very large. So the problem has just begun. So it's a good time to actually try and nip the problem in the bud itself. So that is the reason why central teams have been sent to these states.
These teams, Amitabh says, basically try to ensure that everything is being done the way it is supposed to be.
See, these teams, they carry over the best practices from other states, the learnings that they get from other states, which states have done better, in what situation, what kind of interventions are required. So it's just, I mean, the states also have been handling it for a very long time. So they all know the drill. But it's only in terms of what are the things that can be focused on right now. And if the states need any help or support from the central government, then these teams extend that kind of support. So it's basically a sort of consultative process to look at where the situation is and whether we can steer it in a better direction.
As cases rise, one of the things that states look at doing is restrict movement, implement mini lockdowns, night curfews, and close down market areas. But Amitabh says that with things opening up the way they are, the onus is now also on people to change their behavior.
In this sense, they should be willing to be adhering to physical distancing norms and the wearing of face masks and face shields. So those kind of implementational issues is what is required to be done. Some states are able to do it better, and like if it is not followed, say in the case of Delhi, and we have seen that some punitive measures are being introduced. Also, some of the things that were relaxed earlier are being withdrawn, like gatherings in marriages, for example. So it had been relaxed and now it has to be withdrawn. So those kind of things wherein what can be tweaked, a lot will now depend on the people themselves, whether they are following the norms or not. And the government's role would then come in trying to guide them and trying to cajole them and trying to keep them encouraged in following those norms and creating the right conditions where those norms are not violated.
As mentioned in the previous segment, Delhi has been reporting some of the highest cases and deaths in the country. For the past few days, the capital has been recording nearly and sometimes over 100 deaths every day. In fact, on Sunday, it recorded 5 deaths on average due to COVID-19 every hour. And Delhi's pandemic situation is clearly being reflected in its crematoriums as well. This is what Indian Express's city reporter Ashna Butani found out when she visited them recently.
So whenever there have been fluctuations or rises in deaths, it's clearly visible in the crematorium. So for instance, in August, when the death toll was much lower, there were just 1 or 2 COVID bodies, as opposed to now when there are around 15 to 20 bodies every day.
That's 15 to 20 bodies per crematorium. Ashna's latest visit to the crematoriums was her 5th one since the pandemic started. And this time she said things were quite chaotic.
So people now have to wait in lines for a token in order to conduct the funeral. Crematorium workers, of course, are overworked. They don't really get time to break for lunch or even for tea. Then a number of ambulances are waiting outside with the bodies in body bags, waiting for their turn.
This increase has meant that crematorium workers are working much longer hours. Ashna says that this time has been a stressful one for them, and one that has completely changed their lives.
So some of them are sleeping in the ambulance because they don't want to infect their family, or in the parking lots. and others. So this one who I was speaking to the other day, he told me that he has children at home and they stay in a 2-room house. So he's considering sending his children back to his sister's house, another city, since he is also exposed to the virus all the time. For a while, they did think that, the worst is over and their lives were somewhat returning to normalcy. And, then this new wave set in and it's all back to what it was for them in May and June.
Apart from the stress, Ashna says that this time has also changed job descriptions for some workers.
So, for instance, because of the numbers, there's a pandit who used to do only the puja, and he's now conducting the cremations because there aren't enough people to conduct that many. Or say there's a mortuary worker who has always worked in the mortuary, but now he's deployed in the ghat itself to carry the bodies from one place to another.
Just like every other place in the city, people are expected to maintain COVID-19 protocols here as well. But it gets hard for both workers and the families who come there.
So they're just basically asked to maintain distance because they are around the fire the entire day. They don't wear PPE kits. They just wear masks, and it's actually not possible for them also to wear PPE kits for so long. That's what they say. And for families, there actually one family member who is conducting the last rites. He or she has to wear a PPE kit, and they're just asked to maintain distance. They're asked to be careful, keep sanitizing, but that's about it. And it's quite chaotic in the sense conflicts happen in between families and healthcare workers because, for instance, a family might not want to put on a PPE kit while conducting the funeral, which is compulsory for the person who is setting the fire. Then there are also people requesting officials to let them see the face of the person one last time. And they say that, they're not getting to say a proper goodbye.
The body comes straight from the ambulance and is wrapped, and the families are not allowed to see the face of the deceased. She says that this is one of the hardest parts for the families. There is also no hugging at a time when people really need to be close, and no freedom to conduct last rites the way they have been doing for centuries.
For a lot of families, they have certain traditions that they've been following for so many years. So, for instance, someone told me that, whenever we've had a funeral in our family, there would be around 20 to 30 people just visiting the crematorium. And now it's just one or two of us because we didn't call anyone because we don't want to expose them. And somebody might have a traditional cloth that they want to cover the body in, but that again is against protocol. So the crematorium workers have to say no.
You were listening to Three Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargav, and as always was edited and mixed by our producer Joshua Thomas. Before we go, here's another reminder to check out Indian Express's Explain section. You can log on to indianexpress.com/explain and find in-depth analysis by the right experts. It has everything you need to know to understand the news better and see the bigger picture. If you like this show, then you can subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcast@indianexpress.com.